COVID-19 infections are surging nationally among children, according to doctors, and kids now account for 1 in 5 new patients.
And as those cases increase, so do cases of a rare but life-threatening condition called MIS-C. Let's get to News Center 5's Jessica Brown. She's here to explain how researchers, Jessica, think that they're linked.
You know what, Ed? Public health officials in Italy were the first to notice a mysterious illness affecting children weeks after the country experienced a sharp surge of COVID in April of 2020. The same cycle later repeated itself in other hotspots like London and New York City. That's when doctors made the connection.
She just spiked a fever.
Cece's temperature, 103. Her mom, Sarah, couldn't knock it down.
Kids get fevers, kids get rashes. You never know what's causing it.
And then she noticed her daughter's hands and feet.
So she went from being really, really red to having complete blue and purple feet and hands and lips.
Cece arrived at the emergency room tired and hot.
She had a really rapid heart rate, which was probably the scariest.
Just weeks earlier, Cece and her parents tested positive for COVID-19. Her dad developed mild symptoms. Cece and her mom had none. Once their quarantine ended, Sarah thought the danger for her family was over. But COVID had triggered something else in Cece called multi-system inflammatory syndrome in children, also known as MIS-C or MIS-C.
It is definitely an immune response.
Dr. Adrienne Randolph is a critical care specialist at Boston Children's Hospital, currently collecting data for several federal studies.
The hyperinflammatory response in part is because the immune system has never seen this virus before.
MIS-C often appears about 3 to 6 weeks after a COVID infection and can cause inflammation in a number of body parts, including the heart, lungs, abdomen, and brain. Even though it's very rare, affecting just 3 per 10,000 people under age 21 who are exposed to the virus, it appears to be more common in children ages 6 to 12.
About 70% of them end up in the intensive care unit.
With pediatric cases surging in the U.S. since August and no vaccination authorized yet for kids under 12, Dr. Randolph says she expects more MIS-C cases to emerge.
We're watching very carefully, and we anticipate that if it is going to peak, it might be happening soon.
In rare cases, MIS-C can be fatal, but most patients do well with supportive care. While there's little data so far on long-term complications, especially involving the heart and brain, Dr. Randolph is optimistic there's a long-term solution.
It's very likely that vaccination is going to prevent MIS-C because then the patients already have antibodies and it's not their first exposure. Hopefully it will go away and we will see very few to no cases in the future.
Well, Pfizer announced yesterday that a smaller dose of its vaccine produces a strong antibody response in children ages 5 to 11. So that solution to MIS-C could arrive very soon. I'm Jessica Brown, WCVB News Center 5.